AI Model ICU Risk Classification Trend. AI Model by Pradeep K. Suri. AI/ML Model, Hospital Point of View. This video visualizes ICU patient risk classification trends comparing actual data from 2024 and AI forecast data for 2025. The analysis is essential for hospital resource planning, staffing, and preventive healthcare strategies. Hospital key insights from the image. Bar chart risk categories. The chart breaks down ICU patients into 3 risk levels. Low risk, light green largest group, relatively stable but with slight decline during mid-year. Medium risk, yellow fairly consistent, around 20 to 25%, suggesting manageable patient conditions. High risk, red most critical category focus of attention in hospital planning. Chart increasing high risk trend, dashed line with dots. 2024 trend, rises from Jan to Aug, peaks in August, then declines. Indicates possible seasonal spikes or external factors, example infections, heat waves. 2025 forecast, AI model predicts a moderate but consistent rise mid-year. Suggests a proactive alert for potential critical patient influx during that period. Brain implications for hospital management. 1. Resource allocation. Peak in high-risk patients, 2024 Aug, forecasted 2025 Jul, Aug, may require increased staffing, ICU beds, ventilators. Supply chain planning for essential drugs and equipment. 2. Preventive measures. Hospitals can use this model to launch public health campaigns before high-risk periods. Encourage early intervention or checkups for high-risk patients. 3. Training and readiness. Train ICU teams to handle critical care peaks during forecasted months. Shift schedules can be optimized based on trend forecasts. Pushpin graph design notes. Background, black, ideal for clarity and digital display in hospitals. Colors, clear and distinct for easy understanding at a glance. Legend, clearly labeled for low, medium, and high risk. Title, indicates this is AI-generated helps in trusting predictive analytics. Receipt conclusion. This visual is a powerful hospital dashboard tool that bridges actual performance, 2024, with AI-driven forecasting, 2025. It allows ICU and hospital administrators to anticipate demand, improve patient outcomes, streamline hospital operations, mitigate crisis response lag. Hospital ICU Patient Risk Classification Dashboard. Report, 2024 Actual vs 2025 Forecast. Prepared by AI Model Architect, Pradeep K. Suri. Bar Chart Risk Segmentation Overview. Risk Category Description 2024 Trend 2025 Forecast. Low risk patients with minimal complications declining slightly mid-year, stable otherwise slight recovery towards year-end. Medium risk patients with moderate risk consistent 22-25% stable with mild increase in Q2, Q3. High risk critical patients requiring attention peaked in August 2024, 27%. Forecast to peak again around Jul, Aug 2025. Chart increasing key trend insight. High risk ICU patients, %. 2024 peak, August, 27%. 2025 forecasted peak, July, August, 24%. Trend line indicates early signs of rising critical cases, requiring preemptive measures. Hammer and wrench operational recommendations. Area recommendation. ICU capacity prepare surge beds and ventilation systems during forecasted peak months. Staff allocation reinforce night and weekend shifts during Q2, Q3, May, Aug. Emergency supplies stockpile essential ICU medications and PPEs. Preventive outreach send early warnings and initiate checkup camps for high-risk populations. AI monitoring integrate real-time alerts with EMR/ICU dashboards for trend deviation tracking. Calendar monthly risk trend, 2024 to 2025. Bars, risk distribution, low, medium, high. Line, high risk percentage trend with forecast overlay. Highlight, Seasonal surge pattern detected, valuable for annual ICU calendar planning. White heavy checkmark conclusion. This AI-powered ICU risk forecasting dashboard provides hospital management with actionable insights for critical care preparedness. With proactive implementation, the hospital can improve patient outcomes, enhance resource efficiency, support data-driven decision-making. Thank you.